The Fuo testing center will produce results in a maximum of 45 minutes using a portable PCR machine as well as an antigen testing device. The new center will augment the two testing centers, namely the Tamale Public Health Referencing Laboratory and the Pong Tamale Veterinary Laboratory, which have served the entire northern region over the period. As COVID-19 certification becomes part of international travel requirement, travelers are obliged to present their test results at the airports before embarkment. The demand for it due to travel compels prospective travelers from the north to go down to Accra to acquire their agent results. Speaking after the launch of the center, the Chief Executive Officer of the Fuo Community Hospital, Alhaji Idi Sumaila, explains the essence of investing in the COVID-19 testing center was to present people from the north with such an opportunity.
It is twofold. The first is humanitarian, and also the second is enhancing our line of business. As you are aware, I think this initiative is the first private hospital to venture into COVID testing in the northern sector. Previously, I think it's only the Tamale Teaching Hospital Reference Lab. But we thought that it is important for private initiative to help government in the fight in resolving this pandemic. So we decided to invest in it. And this is a collaboration between Fuo Community Hospital and M-Pharma, which is one of the biggest pharmaceutical companies and health service delivery companies in the country.
When the outbreak of COVID-19 occurred in the country, samples were initially transported to Kumasi and Accra from the north for testing until the two centers were set up. Unlike the bigger testing machines, which takes up to 90 samples at a go, the Fuo PCR testing machine is a mini machine which takes only one sample at a time. The Deputy Director in charge of clinicals in the northern region, Dr. Brema Baba Abubakari, lauded the initiative by the management of the Fuo Community Hospital.
We came from where samples were physically taken to Kumasi for testing. And it was taking us a whole lot of energy, time and money to send it there to be tested. Then we got to a point where we started testing locally here in Tamale, augmented by another testing center in Pong Tamale. And so if we are getting the private sector now coming in, it means that everybody is concerned as far as management of COVID and prevention of the spread is concerned.
On the number of COVID cases in the region, Dr. Brema said the region is heading to 0 cases by next week if things remain the same, as only 3 COVID-19 patients are currently on their records.
As we speak now, we have only 3 active cases. And the 3 active cases, they are not even on admission. They are people who are asymptomatic and they are in the house. So we are not currently having anybody on admission and being treated for COVID. So our situation here reflects the national situation. So, and I believe even the 3 active cases who are on the care pathway, within a week they will all recover.